Hi everyone, my name is Clodagh Scannell. I'm a registered dietitian and I work in the oncology unit in the Mercy University Hospital down in Cork. I'm also a PhD researcher working with cancer and nutrition with the Clinical Nutrition and Oncology Research Group, which is based out of UCC. And today on behalf of Cuishnor, I'm here to present on how to cope with eating difficulties and the side effects of cancer treatment. So this video, I suppose, is intended for people who have been diagnosed with cancer, who are going through treatment and find that they have a reduced appetite. They may be experiencing, I suppose, side effects of treatment, maybe nausea, bowel issues, fatigue, which may be affecting their eating. They have lost weight because of, I suppose, of the cancer, or maybe because of the treatment, or are underweight. So if any of these do apply to you, I would urge you to discuss with your oncology team and ask, can you speak to a dietitian? The video, or the information in this video, is not intended to, I suppose, replace or precede any information that you've gotten from your oncology team who know you personally. This is just for kind of a general oncology audience. So in the area of weight loss and cancer, I suppose there's been a lot of research done. We're doing a lot of it down in UCC at the moment, but it's very common for people to experience weight loss during cancer, and that could be from the point of diagnosis the whole way throughout their treatment. And I suppose a statistic is that 50 to 80% of cancer patients lose weight, and then I suppose even more importantly, 4 in 10 actually lose muscle. And with this, there's been lots of research done to show that if we lose muscle while going through cancer treatment, that might, I suppose, increase our risk of complications. We might have poorer tolerance to treatment, and we might just have a reduced overall quality of life because you're not able to do the things that you love maybe as well. So it's really important that, I suppose, nutrition is at the forefront of your mind while going through cancer treatment. It's something that's really, really important, and something that we should, I suppose, take just as seriously as our treatment. So one of the most important things that you can do is monitor your weight while going through treatment. So you might go to your oncology unit for your treatment maybe every 2 weeks, every 3 weeks, every 4 weeks, and you might get weighed by the nurses there. And that's great. But what I would do, and I would urge you to, is take a note of these weights. So maybe bring a notebook and pen, or write it in your phone and keep a track of it yourself, because you might go up and it might be a different nurse who doesn't know you, or they might not notice the trends, but at least you'll have the results yourself. If you don't get weighed, maybe you're on an immunotherapy and you don't get weighed, borrow a scales, or maybe a friend will have a scales, or you might have a scales at home, and you could weigh yourself maybe every once or every twice, once a week, or maybe every 2 weeks, and just keeping track of the figures yourself. So the best way to do it is when you get up in the morning in a light pair of clothes, after you've gone to the bathroom. That's probably the most accurate time to take your weight. And then at least, as I said, you'll be able to monitor yourself. And if you notice any changes, you notice you're losing weight, bring it to the attention of your oncology team, who can refer you to a dietitian. So dietitians are the only healthcare professional who are regulated by law in Ireland, who are able to work with people who are ill, who are sick, who are vulnerable. Dietitians are the only healthcare professionals who are allowed, I suppose, assess and diagnose and treat nutritional issues in a hospital setting. So this is where you should be getting your advice from. So what does the evidence say? So if we're losing weight while going through cancer treatment, the evidence suggests that we should be following a high protein, high calorie diet, which you might say is very different to what you've heard from healthcare professionals before. You might know a healthy, balanced diet, or lots of fruits and lots of vegetables. So this is very different. And I suppose when we're sick and we're losing weight, I suppose the rules go out the window a little bit. So a high protein, high calorie diet can help you to maintain your energy. It'll help support your immune system. It'll help reduce the risk of infection. And then all those kind of extra nourishment that you're getting will help you to recover faster. So calories are the energy that we get from food, and foods that have lots of calories in it are things that are high in fat, things that have kind of butter, oil, cream, nuts, cheese, all those kind of foods, which again might sound weird, but this is what the evidence says. Protein then are the building blocks of our muscles. So I suppose we're very susceptible to losing muscle while we go through cancer treatment, so we want to make sure our stores are topped up and replenished the whole time. So foods that are high in protein are things like chicken, fish, meat, eggs, nuts, if you're vegetarian, maybe lentils, beans and peas, and then there's also things like kind of tofu and kind of meat alternatives as well. So ways that we can incorporate in more calories to our foods is things like adding, say, like butters or oils to things like soups and mashed potatoes, sauces. Maybe you're having some cooked veggies and you could put some butter on top of that, or having maybe a creamy sauce with pasta or with fish or with chicken. We could add, if we're having kind of something sweet, then we could add cream to it. So whether it's an apple pie with some cream, or maybe some fruit and a full fat yogurt, you're getting good nourishment there. You could add cheese to things, so be that on top of potatoes, on casseroles, omelettes, or into sandwiches. If we're preparing food, maybe now is a good time to kind of saute or fry foods in kind of a nice olive oil or rapeseed oil. Adding nuts to kind of cereals or porridges or desserts. And then if we're having a sandwich, maybe salad, maybe bulking that up with things like coleslaw and potato salad. And again, I know this might sound like counterintuitive, not what you've been told before, but this is what the evidence supports. Again, with the protein then, as I mentioned, it's the building blocks of all our muscles. We should be having a protein source at every single meal. So if you're having 3 meals a day, that's three bits of protein at every single meal. If you find that maybe 3 meals is quite filling, and you're having 5 to 6 maybe smaller meals and snacks, maybe having yogurts as snacks or cheese and crackers as snacks or a handful of nuts, that's a great way to get your protein in as well. Milk is very underrated, so it's a great snack. It's something that you can take very easily out of the fridge. There's lots of good nourishment in it, but I would say use the full fat varieties for this time. You're getting extra calories, extra protein and nourishment there. Things like eggs are really handy as well, so you could have maybe a hard boiled egg for breakfast. You could, incorporate it into snacks, or just have it, in a sandwich or something like that. That's easy to do and easy to prepare. You may have been prescribed oral nutritional supplements. So an oral nutritional supplement is something that is prescribed by a dietitian or a doctor. It's essentially kind of a milkshake based, there's juice based ones, or there's yogurt based ones that is a compact boost of nourishment. So these small drinks can contain up to 300 calories and kind of 18 grams of protein. So if you have been prescribed one, I would urge you to take them. They're very useful, they're very handy, and they've been prescribed for a reason. So if you need it, it's a great way to increase your calorie and your protein intake. So now I'm just going to discuss some of the side effects of treatment and some of the ways that we would deal with this in the oncology setting. So with chemotherapy in particular, and maybe with the cause of the tumour, people can experience a very poor appetite, and that could be due to kind of external stresses. So what we find is that there's probably a point throughout the day that you find that you are the most hungry. So whether you wake up in the morning, that's when you're hungry, or maybe you feel a little bit groggy in the morning and things kind of get better as you go out through the day. So I would capitalise on that. You'll start to know yourself when you start to feel the most hungry, and that's when you should be having your biggest meal of the day. As I said, the rules kind of go out the window with regards to kind of meal pattern a small bit. So capitalise on when you feel hungriest and have your biggest meal then. It's really important as well that you eat little and often. So you don't want to leave large gaps between your meals, because you need to keep your stores replenished and topped up to keep you kind of fighting fit. So every 2 to 3 hours is probably the best way to do it. Some people find that large platefuls, say whether that be your breakfast, your lunch or your dinner, can be quite off-putting and maybe disheartening if you're used to finishing a meal and now suddenly you can't finish it anymore. So breaking the 3 meals a day into your 5 to 6 smaller meals and snacks is a great way to make sure that you're eating every 2 hours, you're getting the most nourishment into you that you can. As I said, milk is a great way to incorporate an easy snack and getting lots of protein and lots of calories in there. So with this as well, you want to stay hydrated going through treatment, but if your appetite is poor, there's not a lot of wiggle room for fluids. So I would encourage you to not fill up your small stomach with fluids that I suppose have no nutritional benefit. So what I'm talking about here is things like waters, teas, coffees, maybe a packet soup, a bovril, things like that. If you're drinking quite regularly, you're just filling up your stomach with something and you're not getting any calories, you're not getting any protein. So I would say swap to things like milk, as I've mentioned, or maybe a juice or smoothie, a milkshake, something that is giving you nourishment as well as hydrating you. It might as well be a good idea to maybe not drink fluids prior to eating, and kind of wait until after eating, so at least then you're filling up your food or your belly with the food rather than the liquid. Fibre then is a component of things like fruits and vegetables, or you find it in maybe your whole grain cereals, porridges, brown breads, brown rice, things like that. And fibre is really filling. So if we eat lots of fibre, we might not be able to eat as much because the fibre is filling us up. So for the duration of your treatment, it might be a good idea just to swap back to, say, white bread, white rice, pastas, those kind of foods, just so that you'll be able to consume more and get more, I suppose, bang for your buck, essentially. Again, this might sound counterintuitive to what you've previously been told, but it might be a good idea to avoid maybe diet, light, reduced fat, reduced sugar products. So what comes to mind is things like diet yogurts, or maybe like a low-fat mayonnaise, a low-fat coleslaw and potato salads. So you want the full fat, the full sugar kind, just so you're getting more energy for the foods that you're having. This is a nice one to tell people. I would encourage some of my patients to have a dessert every single day. It's nice to change and get a mix of savouries and sweets, and you might find that maybe you're full from the dinner, but something like a dessert or an ice cream might appeal to you. So ice creams, milk puddings, even if it's a yogurt or maybe a custard pot, something that's easy for you to consume and to prepare. And also, I suppose, with a poor appetite, sometimes exercise can be really beneficial for stimulating appetite, or even just short time spent outside can kind of get the appetite going. Another one then, kind of that I would see a lot, is fatigue. And going through cancer treatment can be exhausting. You have to go for bloods, you have to go to see your doctor, you have to see your oncologist, you have to, turn up for lots of appointments, and then you're dealing with the treatment itself, and it can be exhausting, and people often complain of fatigue. And if, I suppose, fatigue persists, we might find that we're not able to shop, we're not able to cook, we're not able to prepare our meals. So the most important thing that you can do is not to be afraid to ask for help. So be that maybe a friend, a family member. If you don't have them, maybe ask to link in with the medical social worker that is in your oncology unit, and they might be able to help you get in touch with, say, a Meals on Wheels service, or show you how to order your groceries online. There's lots of big supermarkets that will deliver your shopping to your door. So don't be afraid to ask for help. That's what we're all there for. Another good thing to do is, I suppose, maybe as you're coming towards the end of your 2-week cycle and you're due back in for treatment on Monday, but the Friday before you actually are starting to feel well, maybe that might be a really good time to prepare your meals and put them in the freezer, so that then when you're feeling that little bit more tired after treatment, you can just take it out, defrost it, it's already done. So capitalise on when you feel best, and it'll only be you that will know yourself. Foods then that, I suppose, require very little preparation, so be that having maybe a tub of hummus in the fridge that you can just take out and have with crackers, always having eggs, maybe some beans that you can put on toast, those kind of things that require very little preparation, but at least you're still getting good nourishment into you. And as I said before, prescribed nutritional supplements, if you're given them, take them. There's something that you can just take out of the fridge, or if you have to have foods at room temperature, just something that can be kept in the cupboard, opened and consumed in 1 or 2 mouthfuls, and you're getting a huge amount of nourishment there. And as I previously alluded to, a short walk, a little bit of exercise can actually help with fatigue as well, because you're getting a good stimulation of hormones and endorphins there. With cancer treatment then, a lot of people would experience maybe severe nausea and vomiting, and this is a really common side effect. But if we're feeling nauseous, it can be very, very difficult to eat. But if we don't eat, that's actually going to make the nausea worse. So even if we do feel nauseous, keep nutrition to the forefront of our mind, because it is so important, and eat little and often. It might be smaller amounts than usual and until the nausea passes, but an empty stomach is only going to make your nausea worse. So bland and cold foods will have, I suppose, less taste and less smell, and they actually might be better tolerated. So maybe leave the roast dinner for another day, and maybe having something like crackers or slices of bread or something like that might actually be better tolerated. Greasy, spicy foods, they're just going to make things worse. Anything that has a very strong odour. So I would avoid them, because you're only going to put yourself off these kind of foods later on down the line. Some people find that maybe ginger can be quite good for nausea, so something like a ginger ale, or maybe incorporating ginger into meals can be quite beneficial for the nausea. As I said, maybe avoiding your favourite foods while we're feeling nauseous might be a good idea. And following on from that, I know I said preparing foods is a great idea, but if we're nauseous, that might not be the time to prepare foods, and maybe asking someone to help with preparation of foods might be a good idea, so that you can maybe sit in a living room away from where the food is being prepared, and away from all those smells. If the nausea persists, that can have a massive impact on your diet, and it can result in weight loss and muscle loss, which we said is I suppose can have a negative effect on treatment. So speak to your oncology team. There's lots of anti-nausea medications out there that can be really beneficial. They serve their purpose. If you need them, take them, because they're just going to have, I suppose, a negative impact later on. Then I suppose because of treatment, and maybe if we have a colorectal cancer or a cancer of the gastrointestinal system, we might experience kind of altered bowel habits. So this can be things like diarrhea and constipation. And I suppose when our bowel habit is altered, it can have a massive impact on the way that we eat and on our nutrition. And if it's prolonged, it'll result in weight loss. So I'm just going to touch on diarrhea. So with diarrhea then, if it's prolonged, it can actually cause dehydration. So you're losing water and you're losing your energy from food into the toilet. So it's really important that you are sipping on fluids throughout the day. I spoke earlier about those nourishing fluids. So again, these are even more important in this instance. So you want to be having things like milk or maybe like an electrolyte drink, because you're losing energy, you're losing salt into the toilet. It might be hard to eat while we're experiencing these kind of diarrheal symptoms, but again, little and often is the best way to do it, because an empty stomach is only going to make you feel worse. I spoke earlier about fibre, so we want to limit fibre if we have a poor appetite, because it can fill us up quickly, but fibre can actually accelerate I suppose symptoms of diarrhea as well. So things that are high in fibre are like fruits and vegetables, your brown rices, your brown cereals, your porridge, things like that. So maybe for the time being, reduce them down if we are experiencing some kind of diarrhea. Similarly, things that are greasy or fatty, so like takeaways, kind of high fat foods can make diarrhea worse, as well as caffeine and alcohol. So they'll stimulate, I suppose, our gastrointestinal system, and again make things worse. If it persists, do speak to your oncology team. There is anti-diarrheal tablets that you can take. It won't be forever, it'll just be for the couple of days to get you back on track again. Conversely then, I suppose constipation, it's very common, particularly in colorectal cancer patients, and the way cancer works and the way the treatments work, they do impact our bowels. So there are certain things that can stimulate a bowel motion. So things like, as I said, caffeine can stimulate it kind of the wrong way if we have diarrhea, but maybe with constipation, it's a good way to kind of potentially get things going with again. Foods like kiwis or pears, or even a prune juice, they've been shown they can stimulate bowel motion again. I spoke about fibre and I said not to have it, but maybe in this instance, increasing fibre might be a good idea. And that's why I think if you are experiencing any kind of bowel issues, I would urge that you speak to a dietitian and help get a personalised plan for you, because you don't know whether to have fibre or not to have fibre. So speaking to a dietitian can make things clear for you. When we're constipated, I suppose it can feel like bloating, and we can feel quite impacted. And if we feel like that, it's going to feel like you're full from food. So that's going to have a knock-on effect then on your ability to eat. So you want to, I suppose, sort it out and get it resolved as quickly as possible, because it's only going to impact your eating. Foods then that can, I suppose, contribute to bloating are things like carbonated drinks. So fizzy drinks, if you think of it, the bubbles, can kind of, I suppose, make you feel full and increase that kind of bloating feeling. But there are some vegetables like beans, cauliflower, broccoli, when they break down, they actually kind of produce gas in the stomach. So it might be a good idea to kind of avoid those kind of green leafy vegetables for the time being. Gentle exercise is really good. So a short walk can stimulate bowel motion and help to get everything moving again. And hydration is key. You want to keep yourself hydrated so that things can move easily through you. And as I said, speak to your oncology team. You may require laxatives. It won't be forever, but it's good to kind of get these things sorted before they have kind of a worse impact. Another thing I want to touch on then is, I suppose, indigestion and reflux. So a lot of chemotherapy treatments can cause reflux and can cause indigestion. So the best thing to do here is to avoid large meals. If you're putting large amounts of food down into the stomach, it's only going to make things worse. So again, this small meals quite frequently is the best thing to do it, and let your stomach have a chance to digest things easily. Some people find that things like kind of peppermint tea or like a herbal tea can reduce indigestion and that feeling of reflux. Foods that are, say, fatty, spicy, tomato based, vinegar based, or kind of citrusy are only going to make things worse. So it might be best to avoid those kind of foods just for the time being. Similarly, caffeine and alcohol as well. And indigestion can be made worse if we're lying down. So it's best probably not to eat in a lying position, which I know can be quite difficult if we're feeling fatigued. But sitting at the table, allowing everything to go down the way that it should, is really highly recommended. Again, avoid eating maybe 2 to 3 hours prior to bed so that you're giving everything a chance. And as I said, indigestion, reflux, they can be very, I suppose, debilitating, and if they're prolonged, it'll just have a negative impact on your appetite and can cause weight loss. So speak to your oncology team. There's lots of there's medications that can be prescribed. So with chemotherapy in particular, but also radiotherapy, depending on where you're getting it, it can cause this thing called mucositis. And mucositis is kind of mouth sores, a dry mouth, and it can be, I suppose, very debilitating for people to try to eat with a sore mouth. So then it would probably be a good time to focus on kind of maybe softer foods, so things that are pureed, maybe like puddings or yogurts, mashed potatoes, and things that are just easier for you to eat. If you're having, say, like mashed potatoes, something like that, maybe moisten them up with, say, like a gravy so that it's easier to consume. Avoid things that are, I suppose, have a very hard texture, so maybe crisps, nuts, crackers, or things that are maybe overly tart, salty, or vinegar-based foods, because they're just going to make the pain worse. It's important to sip fluids throughout the day and keep your mouth kind of well hydrated. I spoke earlier about those kind of nourishing fluids, so that's a really good time to get in your milks, your smoothies, your yogurts, and your milkshakes, things like that. If it persists, I would urge you to speak to your oncology team. So there is lots of medication mouthwashes that you can get. So something like a mycostatin or a kin, and they can be really, really helpful for kind of resolving a sore mouth. Similarly, then people might get a dry mouth, and again, it can be very hard to eat if you have a dry mouth and it's something that you can't get rid of. So sipping fluids, your nourishing fluids throughout the day is a really good idea, but also maintaining good dental health and good oral hygiene. So brushing your teeth maybe more than you would normally, so be that maybe 3 or 4 times a day, just to keep everything nice and fresh, and maybe to stimulate saliva a little bit. I touched on earlier your soft, your moist, your pureed foods. So this would be really important, I suppose, when we have that dry mouth. It's best maybe to avoid foods that are difficult to move around in your mouth. So something like bread, or maybe like a pastry that kind of gets stuck to the roof of your mouth. And then some people find that maybe like a chewing gum or like a hard-boiled sweet or something like that, you know, as you move it around in your mouth, it might help to stimulate saliva. With chemotherapy then in particular, some people find that their taste and their smell changes. They might lose their sense of taste and smell, or it might be heightened, or they might suddenly get, I suppose, maybe difficult kind of to deal with taste in their mouth, maybe something that's quite unpleasant, like a metallic or a drug, like artificial taste. So this usually resolves once chemotherapy we come to the end of our chemotherapy treatment, but it can be difficult to deal with in the interim. So what I would say is maybe to try new foods, because something that you might not have liked before might suddenly appeal to you because of how your taste and smell has changed. Similarly, foods that you do like, you might not be a big fan of them anymore, and hopefully it doesn't last forever. So maybe just trying new things and seeing how you fare. Rinsing your mouth and making sure your oral hygiene is up to scratch is a really good way to, I suppose, make sure that you're getting your sense of taste and smell. With cold and lukewarm foods, they kind of have a weaker taste and a weaker smell, so they might be more tolerable to you, as opposed to maybe something that's piping hot or that has just been cooked. If you find that food tastes very bland, it's a really good idea to maybe add peppers, add spices, add herbs, just to kind of to boost the flavour. Something like garlic and onions, you know, there's nice smells and tastes around them. So if it's something that you can tolerate, definitely do. Some people, as I said, get a metallic taste in their mouth, and this is because of the chemotherapy, and it can be very off-putting, particularly with meats. So marinating your meat might be able to make you tolerate it better, but also swapping from metal cutlery to plastic cutlery. A lot of people find that this can reduce that kind of metallically taste that they're getting in their mouth. So myself then and a team of dietitians in University College Cork have actually devised, I suppose, a range of resources that are freely available on breakthrough cancer research on their website. So there's things like information leaflets and cookbooks that are evidence-based, written by dietitians alongside a consultant medical oncologist. And all the information that I've spoke about here is available in these resources as well.